Hello, everybody. This is Dr. Bob DeMaria with another episode of Ask Dr. Bob. What can I do for my osteoarthritis? My doctor said there's nothing that he can do for me. This is what I learned almost with any type of arthritis. You have to work on the liver. The liver is the key to all of it. I would suggest you get my book, Dr. Bob's Guide to Detoxification. Learn about the liver, avoid sugar. Dairy products can create some distress also, and investigate more about what you're eating because that's everything to do with inflammation. Hello, my name is Iris, and you're watching me on the Dr. Axe show. Thank you for watching. You have an 11-year-old daughter that she had a spot on her elbow. I was talking about something called Vitiligo. So I wrote a book, Dr. Bob's Drugless Guide to Mental Health. It is a very interesting book, and what I have learned, there's a protein called tyrosine. Tyrosine is an amino acid. Tyrosine is important for adrenal health, thyroid health, but tyrosine also creates skin pigment. So if someone's underneath severe stress, there's a condition called vitiligo where you start to lose skin pigment, and tyrosine could be your answer. Now, I'm not a dermatologist, so I'm not pretending to answer all of your questions there. You might want to get my book on mental health. There's also a urine test that we can do called the organics urine test that would tell me levels of your tyrosine. Dr. Bob, I have a sores in the side of my mouth that the dermatologist called it lichen planus, or planus licus, depending on which word you use first. The medication he suggested did not work, and I did not have these sores until we put me on a blood pressure medication last year. So step number one, get off the blood pressure medication. I don't have a license to tell you to do that, but there are reasons that you could have high blood pressure, and one of them could be not enough magnesium. You may want to have a consultation with me that we could do some evaluating to see how your body is doing. But obviously, the medication is placing a demand on your detoxifying organs and or stress in your body. Dr. Bob, hi, my question for you is, what do you recommend for severe dental nerve pulp root infected from an ear infection complication? But we use a product called Agricept L. I've been taking 10 drops a day since 1996. The Agricept L helps manage the flora in your mouth. I have not had any kind of dental issue for, I don't even know how many years, but I know the Agricept L really helps that. I also use an item or a product called olive leaf, more of a natural way to help control those unfriendly organisms in your body. Very good question, by the way. Dr. Bob, do you have a protocol for getting off of medication for anxiety? You've been on Zoloft for 10 years, and you want to really know what to do. Well, what I would tell you, what I would do is I'd get my book, Dr. Bob's Drugless Guide to Mental Health, and you have to study. You have to look at your diet. You might want to have a consultation with me. You just can't get off of medications, and I don't have a license to do that. You really need to make lifestyle changes. Whatever you're doing, whatever anybody watching me right now, whatever you have done to this point in your life is why you are the way that you are. So I'm Dr. Bob DeMaria.